Let me tell you something that's going to surprise you. Imagine this. You're 68 years old. You feel good. You're sleeping fine. You're walking every morning. You're enjoying your grandkids. Life is calm. Life is good. Then you go in for your yearly checkup. Nothing is wrong. You feel great. But your doctor takes one quick look at your chart and says those 6 little words that sound so harmless. Let's just run a few tests. 6 weeks later, you're sitting in a hospital gown. You're scared. Your family is scared. And the worst part? Nothing was actually wrong with you when you walked into that office. The tests found something. That something started a chain reaction. And now, your peaceful life looks completely different. I wish I could tell you this is rare. It isn't. This story plays out in doctors' offices across America every single day, and almost nobody is warning you about it. My name is Dr. Lee Wei. This channel exists for one reason, and one reason only: to help adults over 60 understand what the medical research actually says, in plain, simple English. No jargon, no fear, just the truth. And today I'm going to share something with you that most doctors will never say out loud in a 15-minute appointment, because they don't have time, because the system doesn't reward it, because saying less is harder than saying more. Here it is. After the age of 65, some of the most common medical checkups can do you more harm than good. Not because medicine is bad, not because doctors are bad, but because the math changes as you get older, and nobody is sitting down and doing that math with you. Today, I'm walking you through 5 specific medical checkups I would personally think twice about after 65. I'll explain why. I'll share what I've seen happen to real people. And at the end, I'll give you 5 powerful questions to ask your doctor that will completely change how your next appointment goes. Stay with me all the way through, because number 3 has stopped people cold the first time they hear it. And number 5, most folks have never even heard of it until it's too late. Before we dive in, do me a small favor. Tell me in the comments where you're watching from today. Your city, your state, your country. I read every single comment, and it helps me see who's part of this community. All right, let's begin. The most important idea you need. First, before I list the 5 checkups, I need to give you one idea. Without this idea, nothing I say will fully make sense. I call it the longevity lens. When you're 50 years old, screening tests are wonderful. You catch a problem early. You treat it. You get 30 more healthy years. The math works. The risk is small. The reward is huge. But after 65, 3 things change. And they change everything. First, many things found by routine tests in older adults will never actually hurt you. They grow slowly. They cause no symptoms. You will likely live longer than they do. But once a doctor sees something on a report, medicine doesn't have a leave it alone button. It has a treat it button. Second, your body doesn't bounce back the way it used to. A surgery that puts a 50-year-old back on their feet in 2 weeks can knock a 75-year-old down for 6 months. Sometimes longer, sometimes forever. Third, there's something called the cascade effect. One small test finds one small thing. That triggers another test. That test recommends a biopsy. The biopsy leads to a procedure. The procedure causes a complication. And just like that, a person who walked into the clinic feeling perfectly fine is suddenly fighting for their independence. That's the longevity lens. Hold on to it as we go through each one. Checkup number 1, routine colonoscopy. After 75. Let me tell you about Dorothy. Dorothy was 77 years old, a retired school teacher from Tennessee. She'd had 2 clean colonoscopies already, one in her 50s and one in her 60s. No polyps, no family history, no symptoms, nothing. But her new doctor looked at the chart and said she was due for another one. Dorothy didn't want to be difficult, so she went. The night before, she had to drink that strong liquid that clears out the bowels. By morning, she was shaking, confused, dizzy. Her daughter rushed her to the emergency room before the procedure even happened. Dorothy was severely dehydrated. Her potassium had crashed. Her heart was at risk. She spent 4 days in the hospital. She never had the colonoscopy done. And here's the kicker. She didn't need it. The United States Preventive Services Task Force, the top group that sets screening guidelines in this country, officially recommends against routine colonoscopy screening for average risk adults after age 75. The risks are real. Bowel perforation, which is a literal tear in the colon, happens in about 1 in every 500 colonoscopies. In a younger person, that's manageable. In a 77-year-old, it can mean emergency surgery, a colostomy bag, weeks in a hospital bed, and a complete loss of independence. What to do instead? Ask your doctor about a stool-based test like Cologuard or the FIT test. They catch real warning signs without the risks. And of course, if you have actual symptoms, blood in your stool, sudden changes in bowel habits, that changes everything. Get checked. Checkup number 2, aggressive cancer, screening for people without symptoms. I want to be very careful with this one because cancer screening saves lives. Let me say that again. Cancer screening saves lives. But after 70, aggressive cancer screening in people who feel fine and have no risk factors has a serious overdiagnosis problem. Let me explain what overdiagnosis means in plain words. Modern scans are so sensitive, they can find cancers that are basically asleep. Tiny, slow. Cancers that, if left alone, would never grow, never spread, and never cause a single problem. You would die with them, not from them. That's a critical difference. But the moment a radiologist writes the word cancer on a report, the whole system kicks into action. Biopsies, specialists, treatments, surgeries. Whether or not the cancer was ever a real threat to you. Take Richard, 79 years old, a retired mechanic from Georgia, sharp as a tack, still fishing every weekend. His PSA came back a little high. The biopsy showed a slow-growing prostate cancer. His doctor recommended radiation. Richard trusted him. He went through it. 1 year later, Richard had chronic fatigue, urinary problems, and a quality of life that had dropped through the floor. The cancer he was treated for was the kind a man his age would almost certainly have lived alongside. Not died from, lived alongside. Studies in the New England Journal of Medicine have shown that a large percentage of cancers found in older adults through routine mammograms and PSA tests are clinically insignificant, meaning the treatment offered no benefit, only side effects. What to do instead? Sit down with your doctor. Ask about your real risk. If you have a family history, screen. If you have symptoms, screen. If you're average risk and feel fine, ask this question. If we find something, what would we actually do about it at my age, and would the treatment improve my life? That one question changes everything. If you're still with me and finding this useful, type the number 2 in the comments. It tells me you're here and following along. Checkup number 3, routine cardiac stress testing with no symptoms. This one shocks people because it sounds so reasonable. Your doctor says, "Hey, you're 70, let's just check your heart." You walk on a treadmill. They watch your heart. Sounds like good care, right? Here's what most people don't know. Cardiac stress tests in people without symptoms have false positive rates as high as 40% in older adults. That means almost half the time, the test says something is wrong when nothing is wrong. But your doctor can't just shrug at an abnormal result. So that false alarm sends you into the next step. A cardiac catheterization. That's where they thread a tube through your blood vessels into your heart. It's a real procedure with real risks. Bleeding, blood vessel damage, irregular heartbeats. And in rare cases, it can cause the very heart attack or stroke it was trying to prevent. Now here's where it gets really wild. If they find a partial blockage during the catheterization, and most people over 70 have some, they may put in a stent. But the major ISCHEMIA trial a huge landmark study, found that putting stents in people with stable heart disease did not reduce heart attacks, did not extend life, compared to just medication and lifestyle changes. Let me say that one more time. The stent did not help more than the medication, but it brought its own risks, and a lifetime on blood thinners, which carry their own bleeding risks. So you went from feeling great to a routine test, to a false alarm, to a procedure, to a stent, to blood thinners, and you ended up no better off than someone who took a pill and walked 30 minutes a day. What to do instead? If you have no chest pain, no shortness of breath, no dizziness, focus on what actually works. Blood pressure control, cholesterol management, daily walking, good sleep. That's where the real heart protection lives. Checkup number 4, routine bone density scans that lead straight to medication. This one makes people uncomfortable because broken hips in older adults are devastating. Real talk. So let me be careful here. I am not telling you bone health doesn't matter. I am telling you the automatic pipeline that often follows a DEXA scan deserves a closer look. Here's how it usually goes. You get a DEXA scan. It shows lower bone density. Your doctor prescribes a medication, usually a bisphosphonate like alendronate. You take it for years thinking you're protected. But here's what often goes unsaid. Long-term use of these medications has been linked to a strange and serious side effect. Atypical femoral fractures. That means spontaneous breaks in the thigh bone, the very bone the medication was supposed to protect. They're rare, but they're real, and they require surgery. There's also another condition called osteonecrosis of the jaw, bone deterioration in the jaw. Painful, hard to treat. Meanwhile, the single most effective way to prevent broken bones in older adults isn't a pill, it's preventing falls. Tai Chi has been shown to reduce fall risk by nearly 50%. Strength training, removing rugs that slip, installing grab bars, getting your eyes checked, reviewing medications that cause dizziness, getting enough vitamin D and protein. These steps cut fracture risk dramatically with zero side effects. I'm not saying don't ever take the medication. Some people genuinely need it. People who've already had a fracture, people with very low scores, people with specific risks. But for an active 70-year-old who has never broken a bone, that deserves a conversation, not an automatic prescription. What to ask? Can we look at my fall risk first, before we talk about medication? And what is the actual fracture risk reduction this drug gives me compared to a fall prevention program? If you're still here and getting value, type the number 4 in the comments. I love seeing who's tuning in. Checkup number 5, the carotid artery ultrasound. Almost nobody talks about. This is the one most people have never heard of, and based on the research, it might be one of the most important. A carotid artery ultrasound checks the big blood vessels in your neck that bring blood to your brain. The idea sounds great. Find a blockage, fix it, prevent a stroke. But here's the part nobody tells you. The surgery to fix a carotid blockage, called a carotid endarterectomy, carries a 2 to 3% risk of causing a stroke during the procedure itself. In older adults with other health issues, that number is higher. Read that again. The surgery meant to prevent a stroke can cause a stroke. This is why the United States Preventive Services Task Force specifically recommends against routine carotid artery screening for people without symptoms, people with no mini strokes, no sudden vision loss, no neurological warning signs. Here's why this matters. Many older adults have some narrowing in their neck arteries. It's been there for years. Quiet, stable, causing no trouble. But when a routine screening picks it up, a well-meaning surgeon often recommends fixing it. And sometimes, in trying to clean out that blockage, a tiny piece breaks off and travels straight to the brain. People walk into a screening appointment feeling fine. They leave on a completely different path. Not because of the blockage, but because of the surgery that followed. What to do instead? If you have no symptoms of stroke, no sudden vision changes, no facial drooping, no weakness in an arm, You generally don't need this scan. Spend that energy controlling what actually drives stroke risk: blood pressure, blood sugar, quitting smoking, treating atrial fibrillation if you have it, daily movement. If you ever do have stroke symptoms, even brief ones that go away, get checked immediately. That's a different situation entirely. 5 questions to ask your doctor at every appointment. I promised you something you can use today. Here it is. 5 questions. Write them down. Put them in your phone. Bring them to every single appointment. Question 1. What is the false positive rate of this test in people my age? Question 2. If this test finds something, what would we actually do about it? Question 3. What are the risks of that treatment? Question 4. What happens if we just watch and wait? Question 5. What's the strongest non-invasive option for this same problem? Any good doctor will welcome these questions. They'll respect you more for asking. If a doctor brushes them off or makes you feel difficult, that tells you something important too. A final word from me. Here's something I want you to carry with you. There's a difference between medicine that finds things and medicine that helps you live well. After 65, the goal of your healthcare should not be to generate more findings on more reports. It should be to protect your independence, your energy, your ability to do the things that matter to you. The best doctors I've ever known understand something most people never learn. Doing less sometimes takes more wisdom than doing more. Saying, "Let's watch this," takes more courage than ordering another scan. You have the right to know what a test is looking for. You have the right to know what happens if something is found. You have the right to ask whether the treatment would actually improve your life. Medicine has given us incredible tools, but tools only help when they're used at the right time, on the right person, for the right reason. You are that person, and you deserve care that is built around your life, not around a checklist. If this video gave you a new way to think about your health after 65, please subscribe. I post videos like this every week. Practical, honest, backed by real evidence. And tell me in the comments, have you ever had a routine test that led somewhere you never expected? Your story might be exactly what another person needs to hear before their next appointment. Take care of yourselves. I'll see you in the next one.